mobility aids. In physical therapy, there may be a use for mobility aids, and mobility aids are usually labeled as DMEs, which is called durable medical equipment. This is going to involve canes, wheelchairs, crutches, or walkers. And often the patient is prescribed this through a doctor's order. The insurance will cover it. And you may give the patient instructions on how to use this in order to be able to have mobility or ambulate. Now with our canes, they come in different forms here. And the first one here is a standard cane. With a standard cane, this is going to be for a patient who has a good use of mobility, just requires a bit of assistance. Now the tripod and the quad base, named after the bases here. Tripod meaning 3. This has 3 bases. Quad base has 4. These are going to be for individuals that require more assistance. And with these, you have the ability to adjust the handle to meet the patient's needs and height. We don't want to create more problems for our patient by having them hunch over. That can create spinal issues there. Our job is to help with mobility. So we want to teach the patient on how to properly use these, and they should be using these without leaning on them for a huge amount of support. It's just a mobility aid here. Here, there's an adjustment mechanism that you can use to pull it up or lower it to accommodate the patient's height. But again, we only want to see that elbow bent at about a 20 to 25 degree angle without seeing them completely hunched over the device. That's going to cause further problems. For our walkers, walkers have the ability to be adjusted for height as well. And walkers are generally going to be for patients who don't have the ability to walk for long periods of time unassisted. Patients who have balance issues or they've lost their sense of stability may also be prescribed a walker. Whereas crutches, crutches are used to assist with a patient being ambulatory. And crutches take the weight and they transfer it to the arms. So the types of crutches, we have axillary, which is typical. Those are the crutches we see where the base is right underneath the armpit there. These are used for short-term periods. Although we do have what's called the Canadian type of crutch, which is then used for your long term. That's what you see here.